Good afternoon. My name is Megan Jones, and I will be presenting a presentation on asthma management and control. What is asthma? Asthma is a chronic inflammatory condition that affects approximately 7 million children in the United States. It's a condition of inflammation that constricts the airways in the lungs. The muscles surrounding the lungs begin to tighten when introduced to irritants such as pollen and dust. This narrowing of the airways causes an increased production of secretions in the airway, which causes further blockage of the air in and out of the lungs. The causes of asthma can be internal or environmental. Internal causes are genetics, which is also called atopy, which is a genetic condition associated with an increased immune response to allergies such as pollen, dust, or foods. It's also attributed to weight, respiratory infections, exercise, and medications. Environmental conditions can be dust mites, smoke, mold, pet hair, household sprays, pollen, grass, or cold weather. Asthma symptoms are wheezing, which is a high-pitched whistling sound that occurs mostly on breathing out. Increased obstruction occurs when wheezing is heard both on breathing in and out. Coughing, tightness in your chest, and shortness of breath. Asthma treatment goals are based on decreasing symptoms and preventing further attacks. The treatment plan is based on severity and frequency of asthma attacks. The National Asthma Education and Prevention Program implemented the asthma step therapy. Step 1. Utilize a short-acting inhaled bronchodilator. Step 2. Use a low-dose inhaled corticosteroid. Step 3. Use a low to medium-dose inhaled corticosteroid plus an inhaled long-acting bronchodilator or thilenophen. Step 4. Use a medium-dose inhaled corticosteroid plus an inhaled long-acting bronchodilator or thiophenolate. Step 5. Use a high-dose inhaled corticosteroid plus an inhaled long-acting bronchodilator plus omalizumab. Step 6. Use a high-dose inhaled corticosteroid plus an inhaled long-acting bronchodilator plus an oral steroid plus omalizumab. An asthma action plan requires recognition of irritants and allergies, implement steps to control exposures to allergens and irritants, recognize frequency, duration, and measures to control attacks, taking medications as prescribed, and to reduce exercise-induced attacks, take your short-acting bronchodilators at least 10 minutes prior to activity and perform a 10-minute warm-up. Always have an emergency plan and medication available. Consider the use of an asthma action plan that helps you monitor their current severity and frequency. You can use the following link or address below to access one of the many action plans. Indications of poor control is if you have to use your short-acting inhaler greater than 2 days out of the week, if it starts to interfere with your daily activities, or if you use an IS, your volume is less than 1,500 milliliters or less than your normal best expiration milliliters. Increased frequency of sleep interruption and increased visits to emergency rooms.
This video illustrates how to properly use an incentive spirometer. The incentive spirometer is a good measurement of a risk for asthma attacks and lung function.
This concludes my presentation. I hope you were able to learn a lot about control and management of asthma. Thank you.